It's time for a research update on shockwave therapy, and we're going to look at specifically shockwave therapy for Achilles tendonitis or tendinopathy. Quick look at what different types of shockwave you get. Does the research show that it works for tendonitis or tendinopathy? Then, does it work for calcific Achilles tendinopathy? And lastly, can you do damage to your Achilles tendon with shockwave? What are the precautions that somebody should be taking? For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of any type of Achilles injury, all done via video call. If you want to know more about our online service, have a look at the description. I'll put a link to our website there. Shockwave therapy uses sound waves to treat the injured tissue. Now, these sound waves are not the same as ultrasound. It's much more intense sound waves, and it's thought to help the healing process in three ways. The first is that it can stimulate a healing response, because we know that especially for ongoing tendinitis, instead of healing, the tendon is going the wrong direction. And the thinking is that these shock waves can create a small injury that then triggers the natural healing response of the body. Secondly, there's also evidence that the shockwave works directly on the pain system and calms the nervous system down. And then lastly, it's thought that shockwave can perhaps help break up calcifications in the tendon and help them get absorbed more quickly. Now, there are three types of shockwave, and the most commonly used is radial shockwave. These shockwaves are more central, or it spreads in a wider area away from the applicator, and it doesn't go that deep, only about 3 to 3.5 centimeters. Then you get focused shockwave, and this is the one that's used most commonly for calcifications. And depending on the setting of the machine, it can go up to 12 centimeters deep even, but it's usually just a small area that's being treated at a time. And then you have a new type of shockwave that's come out recently, which is defocused shockwave or soft shockwave. Now, there's not a lot of research on this yet, but it's kind of in the middle between radial and focused, that it goes deeper than radial and a little bit wider, but not quite as deep and as focused as the focused shockwave. Does shockwave actually work for Achilles tendonitis or tendinopathy? Well, the research is showing sometimes, but not always, and it's perhaps not a treatment that should be offered to everybody, especially not in the first 3 months after developing a tendonitis or tendinopathy. I should start by saying the research that all this is based on is not of very high quality. The most recent research review that I could find included 9 studies, and out of the 9 studies, 8 were rated to have a high risk of bias. Now, what that means is the way that the study was designed meant that it was either set up to favor shockwave or to be against shockwave, or the way that the pain and things were measured meant that whatever the researcher believed could have influenced the results that they interpreted. So, although this can inform what we say about shockwave, it should not be taken as a 100% rule. And there are other problems with the research as well. So what the research has shown is that if you compare shockwave with standard treatment for Achilles tendonitis or tendinopathy, and the standard treatment usually consisted of exercise as well as load management, which is stuff we always also say to our patients is the stuff that needs to be tried first, the shockwave didn't actually outperform the standard treatment. And if the shockwave was added to the standard treatment, it also didn't really make a difference. Now, the problem for me with this is that, yes, it sounds like the shockwave isn't useful, but the standard treatment may have been the problem. Because if I looked at what the standard treatment included, it was pretty much everybody does the same thing. And it often included things like Achilles tendon stretches. Now, we know from experience that if you include stretches, passive stretches, where you hold a calf stretch for a long period of time, then that often irritates Achilles tendonitis. So it may be that it doesn't matter if the shockwave had a chance of working, they undid the work of the shockwave by adding the standard treatment and stretching the tendon. So I can't say that for certain because there wasn't enough detail about what the standard treatment actually involved. But for me, this just says that yes, it shows that maybe shockwave isn't for everybody, but we can't really say that it doesn't work. The other problem that I have with the setup of the studies is that we know that standard treatment works for most patients if you get the exercise intensity right and the load management well, or do that right. But it doesn't work for everybody. Even if the patient does everything perfectly, there are some cases that just don't respond. And to date, there's no research that really looked at what happens if you have people who don't respond and you just take those and you provide them with shockwave. Does that make a difference to how they then um, react after that? So there are quite a few issues for me with the research at the moment that makes me hesitant to say that shockwave really doesn't work for Achilles tendonitis. So looking at the current research, my advice is, or recommendation is, that shockwave is likely not a magic cure for everybody, and that if you have not yet tried proper load management plus rehab exercises that's designed for you and pitched at the right level for your injury, that's the first thing to do. I would also not use shockwave in the first 3 months after developing tendon pain, because during that period, the healing process hasn't failed yet. Actually, it's still in the period where it can heal normally if you just give it the right load management. But it's only after 3 months, if you're just not making progress, that I would consider adding shockwave in. It's also worth knowing that there are lots of other treatments you can do or try for Achilles tendonitis. And we've made videos in the past when we looked at the best evidence-based treatment for this. So if you want to know more about that, have a look at the description of this video. I'll put a link to that one there. What about shockwave for calcific tendonitis? Because shockwave does sound like it should be helping that. Well, there isn't any research study that I could find that looked specifically at calcific tendonitis in Achilles tendons and shockwave. But there's quite a lot of research on the shoulder as well as the gluteal tendons. And from that research, it does look like shockwave can help with breaking up calcifications. It likely works better for smaller calcifications than larger ones. But in many cases, the calcification is actually absorbed by the body through a natural process without any extra intervention. So again, shockwave is not something that everybody likely needs who has calcific tendonitis. It's also not the first thing I would reach for. I would first apply proper load management, reducing the aggravating activities, and just looking after the tendon and seeing how that reacts. And if it's then needed, add shockwave in perhaps. In the vast majority of cases, shockwave is really safe as long as it's been used in a sensible way. It's absolutely normal to feel pain or discomfort increase for a few days after you've had shockwave, but this usually calms down if you apply ice and just takes things easy. In one study, they showed that there was a temporary increase in swelling in the tendon after the session, but this all resolved after 2 days of just icing the tendon. The problem comes in with over-treatment. The current advice is to leave at least 4 days between treatment sessions. And in the research, they actually only used 1 session per week in most cases. Why not do shockwave every day? Well, it's thought to create small injuries in the tissue, and your body needs time to repair that injury. Otherwise, it can actually accumulate and cause more serious injuries. And there has been reports of people rupturing Achilles tendons after overuse of shockwave, but that was like 10 days in a row, daily sessions. It's also not a good idea to use shockwave very close to the bone when somebody has low bone density. So osteopenia or osteoporosis. It's not the same as osteoarthritis. It's a different condition. Low bone density. And then also, you do not want to use it over an actively inflamed bursitis, or if you have any signs of active inflammation, because it's likely going to make it worse. You could perhaps use it for chronic bursitis because there's not an active inflammatory response at that point, but it really needs to be assessed case by case, and because bursitis can also flare up between weeks where it can be calm versus not. So the take-home message is that shockwave may be useful in some cases. It's not a treatment that everybody should have as standard, and it should be used in moderation. Probably just 1 session every week, and only for cases that's been present for more than 3 months. Brilliant. Hope you found that useful. Let me know if you've got any questions. And if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.